This video is for nursing school students, for new nurses, or nurses who are studying for the NCLEX. Let's talk about shock. Let's talk about the 4 stages of shock and then the 5 types of shock. What the heck is shock? Shock is a critical condition where the body has decreased tissue perfusion and eventually leads to organ failure or death. 4 stages are, first, initial. There's too little oxygen in the blood to feed the organs. You're gonna have some anaerobic metabolism. The metabolism is happening without oxygen, essentially. And then you move on to compensatory. The body is trying to compensate for low oxygen. So the heart's gonna pump faster. Your respiratory rate's gonna increase. You may have a fever. It's gonna speed up the vital signs, essentially. And then you're gonna go into the progressive stage. The progressive stage, cold, clammy skin, and then the last stage is irreversible. Death. There are 5 types of shock that can happen in the body, essentially like the source of it. So let's talk about it. Number 1 is septic shock. It's caused by a blood-borne systemic infection. This is septic shock. Now, neurogenic shock is caused by a spinal cord injury, usually T6 or higher. And then hypovolemic shock, essentially you're just bleeding out and your body's like, we can't do this anymore. Gunshot wound, surgery, things like that. Now, cardiogenic shock is where the heart just fails to pump. It could be in heart failure or an MI, or it's just too weak to do it. And then anaphylactic shock is a severe allergic reaction, like some people have to bee stings or peanuts, for example. And essentially everything just lacks oxygen. So hope this helped you. This printout is actually from the nursing school review section of my NCLEX program, if you're interested.